One other area of dentistry that I have become well known for is my ability to detect and clean out jawbone infections. Jawbone infection, actually 100 years ago or more now, J.V. Black, the father of dentistry, was curious. Why did you have infections in the jawbone that didn't show any signs of redness or swelling or pus or what you would normally, but they were cavities in the bone. So there was a term called cavitation, stemming from his findings. Well, these jawbone infections in the wisdom teeth area are there 100% of the time. In other words, a wisdom tooth was extracted and the bone didn't heal. Once again, nutrition, they weren't in a proper place to heal. They used Novocaine that cut off the blood supply, gave them steroids, which causes bone suppression, used local anesthetic, which causes bone suppression. All these things that didn't allow us to heal, you're left over with this foci of infection. And cleaning those infections out, huge health benefits have happened. Cancer, ALS, just overall sense of well-being, and little aches and pains, depending on where it is found and which meridian it's attached to, will depend on the level of recovery from that particular infection that the patient sees. So it's very interesting, and we're doing now DNA analysis of the different organisms that we find. Dental DNA as a lab out in Colorado Springs, and we can now analyze the bacteria. Not that we know what to do with them at this particular point. We do know that some are what antibiotics we can use versus a different antibiotic. And but anyway, that's where we're going with the jawbone infections. And and once again, that's a palpation. The doctor can just palpate that. If there's pain, I use a Q-tip. If there's pain, then you know you have a jawbone infection. CAT scans are wonderful diagnostic tools for that. Thermograms are also a nice tool to use, as well as traditional dental x-rays. And cleaning those out, once again, the nutrition has to be addressed. You have to use the right protocol. I don't use Novocaine in my practice when patients are sedated for these procedures, so that I get adequate blood supply, and they fare well.